Moles are, something that develop, naturally throughout the early stages of life. So they are in and of themselves not necessarily worrisome findings. I think some important considerations that parents should think about is number one, family history of melanoma, for example. So with moles, what we really worry about are primarily number one, first and foremost, melanoma. And so family history of melanoma is a consideration. We know that melanoma does have a genetic basis and is more common in first degree relatives. So considering a family history of melanoma is something that people should be aware of and take into account. There's different types of moles. There's congenital moles, which kids are born with, and those, we usually consider those based on size, and the smaller or medium-sized moles that kids are born with, they will grow with time, and as a kid grows, they will grow naturally, and that's to be expected. So that's not worrisome in and of itself. And the risk of a mole of that type developing into melanoma is thought to be very, very low. So that's generally a reassuring thing. It's not zero, but it is quite low. And so, um, you know, uh, in general, I would say that just because someone has a mole, it doesn't mean necessarily anything terribly worrisome. Um, Now, if a kid has numerous moles, over 50 or over 100, that does increase the risk of melanoma as well. So in those cases, that does warrant an evaluation and a visit with the dermatologist. Or if someone has a very large mole, and something that is not that medium or small mole, but something that's very large, there is a bit of a higher risk of developing something in those moles. So there's a reason to visit there. Now, beyond that, of course, every case is a little bit different, but I would say that some things to look for is one, one can always have an evaluation for a mole and see a dermatologist and get some reassurance if one would like. But the important things to look for are changes to the mole that would reflect something different than just growth with the size of the child. So if the growth is, or the mole is changing in a way that is different than just the overall growth of the kid, if it's growing at a rapid rate relative to the kid, or if it's developing excessive kind of bumpiness or color change that looks out of proportion to the development of the kid as a whole. So it's normal for some level of growth and some level of bumpiness and maybe even some subtle color change. But if it's turning multiple colors or developing a particular kind of area that's becoming really elevated or ulcerated or bleeding or something like that, those would be the things that you would really want to look for. Or if there's a worrisome family history or numerous moles, I think those are all signs that one should see a dermatologist.
So it sounds like rapid change is a definite red flag for concern.
For sure, rapid change is probably the biggest one, and beyond that, it's a little bit subjective, but I would say most moles, a lot of melanoma develops in new moles rather than pre-existing moles. So we often will see moles, we'll track them and see how they're changing, but if they're stable, that's a really reassuring.